the least, we explore the wonders of tech in the healthcare industry in this, our last panel discussion. I bring you over to Mr. Kurt Ugas of Soprano and Dr. Brian Tan of Salesforce. Hello and welcome back, gentlemen. All right, I'm trying to find the first question here. This is directed to Kurt of Soprano. How do you see a messaging platform will contribute or help the healthcare industry? I think we talked a lot about this as well in the previous panel in terms of trying to get together all the different ways of communication.
Yeah, thank you, Danny. That's correct. And again, good morning. So, well, actually, a good messaging platform, or I would rather say an effective messaging platform, is really vital this time, especially here in the Philippines. So, even prior to the pandemic, the common challenges the healthcare institutions are facing is that the workers are overworked or under-resourced. Moreover, they are using outdated staff and patient communication tools. They have poor patient care management. They spend too much time on administrative works and documentation, and the lack thereof of security and data privacy brought about by manual process. While a messaging platform helps to improve staff efficiencies using automated technology to trigger communication that needs to be sent periodically. It enables doctors, nurses, and staff to communicate while protecting patient information. They can send shift offers to reach available on-call staff, doctors, and nurses who can confirm or decline at the push of a button. It can reduce failure to attend rates by allowing patients to cancel and reschedule appointments right from their mobile devices, or engage with patients by creating unique two-way mobile interactions in real time. So in summary, a messaging platform actually increases the healthcare institution's day-to-day operating efficiency.
Excellent. So efficiency because of the timeliness and the urgency that needs to be happening here when it comes to messaging. This question is for Dr. Brian Tan of Salesforce. What is Salesforce doing in healthcare specifically?
Well, good day, Danny, and it's a pleasure to spend time with you and the audience today. I feel like Salesforce is healthcare's best kept secret sometimes. And actually, Salesforce has been serving healthcare clients for almost 20 years. Many of its early customers were actually pharmaceutical companies and medtech companies utilizing its capabilities for assisting in sales and marketing automation. Since then, of course, Health Cloud has actually been one of the major investments of Salesforce. At its heart, we're using the customer relationship platform and replacing the customer with the concept of a patient and using clinically relevant data concepts in order to create that clinically relevant solution for our healthcare clients. Essentially, the secret sauce is we're using low code, no code, and deep capabilities for drag and drop, for example, to design some really nice customized workflows for individual patients and also for the staff working in hospitals, clinics, and any number of healthcare providers, including diagnostic providers like diagnostic imaging and pathology labs, as well as aged care providers and in-home community providers as well. I'm like a doctor working in Salesforce. I feel like a kid in a candy store because I have a lot of toys to play with here, including not only Health Cloud, but MuleSoft for integration using APIs and Tableau for data visualization, and more recently Slack as well, which is a huge promise for healthcare.
That's so exciting. Indeed, as you mentioned, from clients to patients, patients to clients, all the same, you need to deliver the service at the best time in the best ways. All right, this question is for Kurt. How will an omni-channel solution benefit the clients and their customers? You talked about messaging, but let's talk about omni-channels.
Yeah, thanks again for that question. So in today's world, people's behavior has changed and you will not find them basically in just a single communication channel. So with this various messaging platform available nowadays, people now have their own preferred platform. So with this, healthcare providers need to cope to this new normal and be able to communicate with the patients effectively. Through the omnichannel solution, medical teams can actually communicate, reach and coordinate with doctors, nurses, and patients in real time, whether it be through SMS, OTT, interactive messaging, email, API, or voice. Healthcare systems can use interactive messaging to transform and impact the future of how they engage and communicate. With the range of smart APIs, integrating with their existing IT or EHR and EMR system is simple. Automate communication and workflow process throughout the facilities to bring the on-call staff, doctors, and nurses, along with the capability of intelligent escalation rules. Also, Patients benefit from increased access to their medical histories, which reduces chances of medical errors. And with these solutions, healthcare providers will save time, reduce costs, gain productivity, and improve quality of patient care.
Thank you so much. And we do need that. We have different ways already to communicate. And the best way forward is for us to be able to have access at any time, anywhere. And finally, this is a very broad question, but I think as doctor in technology, you're in the best position to close off this very interesting session. So Brian, what opportunities do you see for technology to make a difference, but really a real difference in healthcare?
Thanks, Danny. Well, you're right. It is a broad question. Actually, technology has been important to health and clinicians all the way back when cutting-edge clay tablets was the cutting edge of technology for Mesopotamian healers to record their patient encounters. And we jump forward in time, obviously, lately in our time, cutting-edge technology like AI, robotics, and also cloud technologies are incredibly important for making a difference in healthcare. There's a vast and growing evidence body of literature that shows that we can save lives and change lives through the use of technology. We've moved, of course, from Cloud 1.0, where we saw the likes of Amazon and Google transform our lives on our desktops, through to Cloud 2.0, where we access the internet on our phones. And now we're actually in Cloud 3.0, the age of Slack, Zoom, and in healthcare, care anywhere, essentially in our homes, when we're walking around in our cars, etc. Really, what we're trying to achieve in technology now is to move away from that old patriarchal, paternalistic form of medicine towards a much more patient-centric, patient-empowered form of medicine. We're moving away from a reactive form of medicine when we waited for patients to get sick to see their doctors towards a much more proactive and predictive model of medicine as well. And there's a whole trust aspect to the use of technology in healthcare, which is really changing lives as well. In other areas, who knew that years ago we would actually be using technology to sleep in a stranger's bed or book a ride in a stranger's car? But that trust combined with the use of technology is really transforming the models we're seeing in healthcare.
Excellent. So from complementary, healthcare and technology in the Mesopotamian era, as you mentioned, now it's synonymous. It's really interchangeable. Technology is healthcare. Healthcare is technology. So thank you so much for those amazing insights, gentlemen.